Hi guys, welcome to my videos. So guys, Government of Ontario has made a change. Starting today, pharmacists in Ontario can prescribe medications, common medications for 13 most common illnesses. Be it acid reflux, like there's the list. I don't want to go into that list because that's not what I'm gonna discuss in this video. So, like, I'm gonna describe my opinion about this action and whether it is sufficient, how it's gonna go forward. So, I'm gonna discuss my opinion about it. Okay, don't consider it like expert opinion, but my point of view on this. So, guys, our healthcare is in crisis. In Ontario, it's definitely, and not just in Ontario, across Canada, it is in crisis. When you have months long waiting, when you have for seeing a specialist, when you have to wait for more than 20, 30, 40 hours at emergency to see a doctor, when you don't get an appointment for weeks, you know that something is wrong, right? Something needs to be fixed. When you have one in six family physicians almost at the retirement age, there is a problem. So with this step, definitely it will reduce pressure on clinics, because let's say you have acid reflux and that requires a prescription to get pantoprazole, a very common medication, issued to you. So a pharmacist, although may have a sufficient stock of it, cannot issue it to you. Although they know that you need it at the moment, you need to get a doctor's prescription. Otherwise, you got to manage with over-the-counter medications. So what happens is, like, a lot of these people end up going to walk-in clinics or booking appointments with family physician. So yes, at this step, because these for these minor things, patients won't be heading to clinics. Nobody want to wait for weeks, right? When they can simply walk into a pharmacy, describe the issue, and get the medication on the spot, right? Because your doctor is not going to issue you the medication. Doctor issues prescription. Ultimately, medication is issued by a pharmacist. So you can get, this is going to relieve the pressure definitely, but up to what extent? That's what the question is. The way the population is increasing and the way our immigration plans are, and the way our healthcare resources are stretched and working over capacity, down the line, I don't think these measurements are gonna help. They may help to reduce some pressure initially, but over the time, it's not gonna help much, because the way population is increasing, the way demand for healthcare resources are increasing, we need to have more hospitals, more clinics, more staff, all kinds of staff, be it support staff, be it nurses, be it technicians, be it helpers, be, and most importantly, be doctors, specialists. We need more healthcare people definitely in this country. Now, few rays of hope I see, that I read in news that starting this year, we are already in 2023, immigration draws in express entry will target healthcare occupations. So I'm really happy about it, because uh, what I have seen is, like, when you don't do based on um occupations. So for certain occupations may not have so much demand, but the number of candidates scoring high points could be high. So a lot of these people will come in. Of course, in order to address individual province demands, we have PNP, but in overall, in general category where mass migration takes place, we should have something based on occupation, especially when countries like Australia are already doing something like occupation ceilings. Something like that needs to be done in Canada as well, and hopefully it is going to be implemented, because certain sectors, for example healthcare in Canada, hospitality in New Zealand, they have like critical shortage of workers. So uh, what I believe is, like, we need to work aggressively, like, at any level, to fill the healthcare gaps, because it's too much. Imagine right now you need some medical help, and you go to a hospital and you are forced to wait for 20 plus hours. How are you going to feel? Do you feel good? I don't find it good, right? You need an appointment with your doctor and you don't see that appointment coming. You need a family physician, but no doctor around you is accepting new patients. So how things will go? So I believe more steps are required. Definitely, this step will help up to certain extent, but down the line, we need more steps, more investment. So, thanks for watching this, guys. Please subscribe to the channel. Thank you.